Blood clots are a leading cause of death worldwide, much more than the total number of people who die from cancer, accidents, and even AIDS. In fact, every 37 seconds, one person in the world dies because of a blood clot. What is even scarier is that some of you may be having a blood clot right now and might not even know about it. In this video, we will tell you about what can be the signs of blood clots, how to identify them early so that you don't land up with further trouble. So let's start with the first part of this video. What are blood clots? Normally, when you have any injury or a cut, the body will try to stop the bleeding, and blood clot is a normal mechanism. But when the body starts developing blood clots without any injury, without any protective mechanism, then they can be dangerous. And these clots can form in your arteries, in your veins, and it may range from the brain, the heart, the lungs, or even the legs. These blood clots are soft jelly-like masses, and they can either stick to the blood vessel or they may travel along with blood and go from one place to another. Such an example is someone who has deep vein thrombosis in the legs, but the clot travels and ends up in the lungs, where it can lead to a life-threatening condition called as pulmonary embolism. A similar clot in your heart can give you a heart attack. If a clot ends up in the brain, it can give you a brain attack or a stroke. And if a clot develops in your leg arteries, then someone may end up developing leg pain, limb ischemia, peripheral arterial disease, or even gangrene. But most blood clots may not show any signs or symptoms until it's too late. That's why understanding these warning signs is crucial. Before we jump into what are the signs, we must also know what can be the risk factors for developing blood clots. Age is the primary factor because as you age, the chances of blood clots increases. The blood becomes more thick and viscous and is more prone to developing clots. Apart from age, the second factor is obesity. People who are overweight will have more stresses on the leg. The blood from the leg cannot go up very easily, giving rise to stasis, which can end up with a blood clot. The third important factor is prolonged immobility. If you are not moving around for any reason, you may be sick, you may have other medical issues, or maybe some injury and you're not moving around, the blood circulation in your legs will reduce, and this can predispose to development of blood clots. This may also apply to people who are flying long distance flights. So that's why one of the reasons why it's also called as an economy syndrome. So if you're flying economy where your legs are tight, there are chances of developing blood clots in your legs. The fourth important factor and very preventable one too is smoking. Smoking can damage the innermost lining of your blood vessels, making it more prone to forming blood clots. So smoking is one of the most preventable causes for developing blood clots. The fifth is pregnancy. Yes, pregnancy-related hormone changes can give a higher chance or higher possibility of developing blood clots. And we often see many females who in their last trimester of pregnancy or just after delivery develop deep vein thrombosis and clotting. The sixth factor is genetics. Some people will have an inherited cause of or genetic abnormality in which their blood becomes thick, and these are called as thrombophilia or hypercoagulable states, and these are passed on from family to family. And the last and the seventh cause may be some chronic ailments and illnesses, which includes cancer, because some people who have a specific form of cancer may be more prone to developing blood clots. So now coming to the most important part, the alarming signs of blood clots. The sooner you identify these symptoms, the faster you can get the treatment done. So the first and most obvious one is swelling in the legs or arms. If someone develops a clot in the leg veins, the first sign to appear is swelling. Sometimes it may not have any pain, it is just sudden onset of swelling. So if someone develops a sudden onset of swelling in the legs, always keep in mind the possibility of a blood clot. The second sign and symptom can be pain or tenderness. So if someone has pain, tenderness along with swelling, it is highly likely the blood clot in the leg is causing problems. and this may not cause any other major problem at this stage. The third important symptom is shortness of breath. Whenever a blood clot travels from the legs to the lungs, where it normally is supposed to go, then that can give rise to shortness of breath, which may happen when walking for a few steps, or sometimes if it gets even serious, then a person can have breathlessness even on talking. So this condition called as pulmonary embolism can often be unrecognized and end up in a massive pulmonary embolism where the patient becomes very critical, has severe breathing difficulties, blood pressure becomes low, and the heart may suddenly stop. So early signs diagnosed in time can prevent a fatal pulmonary embolism. And this pulmonary embolism is one of the leading causes of unrecognized deaths. The fourth sign may be chest pain and heaviness. Sometimes someone may not have breathlessness, but they feel that there is some heaviness or pain in the chest, and this is especially so after they take a deep breath. When you take a deep breath, the lungs expand and they rub against the ribs, and if a lung has some amount of thrombus, clot or embolism in it, then that will be the painful part. So chest pain, especially on deep breathing, can often be a sign of pulmonary embolism. The fifth sign, and sometimes an alarming one too, is coughing out blood. Yes, if there is a thrombus in the lungs, then while coughing out, someone may notice that they are coughing out blood, directly blood and not sputum. So this can be an alarming sign of blood clots. The sixth sign, often a sign of arterial blood clot, is when the skin becomes cold, cyanosed or blue, or sometimes turns black. These are signs of an arterial occlusion. So if the blood flow to that organ, it may be the hand, it may be the legs, if the blood flow to that organ suddenly stops, then that area starts becoming cold, becomes painful, and even there are color changes which would range from just blue to even black, which is called as gangrene. So earlier the diagnosis of color change with reduced temperature is made, the earlier you can get it treated. So now that you know these alarming signs, you must also know what can be the preventive measures which actually can help you stay away from these blood clots. So the first thing is stay active, because immobility is one of the most important predisposing factors for blood clots. Make sure that you keep yourselves active and moving. Every 30 to 40 minutes, take a break, walk around if you're sitting, and if you're standing, you can even sit down for a couple of minutes. So walking around helps to reduce the chance of blood clots. The second tip is to maintain a healthy weight. Being overweight does predispose to a higher chance of blood clots, so maintaining a healthy weight will also help you reduce the chances of blood clots. The third, as I said earlier, quit smoking, which is the most important preventable cause of blood clots. So if you quit smoking and other tobacco products totally, then the chances of blood clots will be significantly lowered. Fourth is wear compression stockings. This applies to people who have had a previous clot or have varicose veins. So if you have these problems, wearing compression socks, make sure that there is no amount of blood pooling in your legs. So if you have vein problems, make sure you're wearing compression stockings regularly. And the fifth important part is stay hydrated. Yes, water is a very important part to maintain our blood flow, blood circulation and blood viscosity. And dehydration can often trigger blood clots. So make sure you're properly hydrated even when you're fasting. And if you're still interested in knowing much more about blood clots, what else can we do to treat it, what are the newer methods of treating blood clots, then you'll find this interesting podcast really useful.